Everyone, my name is Trinity LaBelle, and today I'll be talking about haloperidol, also known by the brand name Haldol. I'll be covering the following topics: background, behavioral effects, pharmacokinetics, mechanism of action, chronic use, and its abuse potential. Let's start with a bit of background. Haloperidol was synthesized in 1958 by Paul Janssen at Janssen Laboratories in Belgium. It was made from a compound called phenylpiperidine. Since then, it's become one of the most widely used first-generation antipsychotics. Behavioral effects. Haloperidol is FDA approved to treat positive symptoms of schizophrenia, things like hallucinations and delusions. It's also used to manage Tourette syndrome and severe behavioral issues in children, such as hyperactivity, impulsivity, aggression, and mood swings. However, it's not without its downsides. Some users report changes in mood like anger, confusion, and contentment. It can also impair cognitive functions, affecting attention span, reaction time, and how fast someone can process information. Pharmacokinetics. There are two main ways haloperidol can be taken: orally or intramuscularly. Oral is more common used for ongoing treatment for moderate to severe schizophrenia. Intramuscular injections are used for acute episodes of agitation. Since oral is more common, I'll focus on that. It's a lipophilic drug, which means it dissolves well in fats. After oral administration, it reaches peak concentration in 2 to 6 hours, and it's typically taken 2 to 3 times a day. About 89 to 93% binds to plasma proteins at a high amount ends up in the brain. The liver plays a major role, 60 to 70% bioavailability after it passes through. The half-life ranges from 14 to 36 hours depending on liver function. It's metabolized by CYP3A4, CYPD6, and CYP1A2 enzymes, and about 30% is excreted through urine. Haloperidol works by blocking D2 dopamine receptors in the brain. To be effective, around 72% of these receptors need to be blocked. It acts as a dopamine antagonist, which over time can lead to increased receptor sensitivity. This can eventually cause dopamine supersensitivity, where the drug becomes less effective. Let's talk about long-term effects. Tolerance and antipsychotic effects is rare, meaning the medication usually stays effective. But with prolonged use, patients may develop Parkinson-like symptoms due to neurotoxicity. Interestingly, people can develop tolerance to some side effects like tremors or stiffness, which is extrapyramidal, which often fade over time. Withdrawal is a concern. If someone suddenly stops taking it, dopamine floods the brain because those D2 receptors are no longer blocked. This can cause a rebound effect called rebound psychosis, also known as like a dopamine flood when blockers stop all at once, allowing an influx of dopamine through the system. Unlike many drugs, haloperidol isn't addictive. It actually reduces dopamine, so it doesn't act as a reinforcer. There's no real risk of physical dependency, but people might stay on it to avoid negative withdrawal symptoms. To summarize, haloperidol is a powerful tool for managing serious psychiatric conditions like schizophrenia. It has a clear mechanism, long-lasting effects, and low abuse potential, but also comes with some notable cognitive and motor side effects, especially with long-term use. Thank you for listening.